I didn't know how we were going to get through, and that's when Greenwood Genetics came in for us, and they were our support system. We call them Charlie's Angels.
In the small southern town of Greenwood, South Carolina, the Greenwood Genetic Center has stood as a beacon of hope and innovation for 50 years. From its unlikely beginnings, the center has grown into a world-renowned institution, making significant scientific advances and transforming countless lives.
The concept for the Genetic Center was really born at Johns Hopkins Hospital in the early 70s. Dr. Harold Taylor and I, both fellows at Johns Hopkins at the time, conceived of the idea of developing a sophisticated genetic center that would bring compassionate services to patients.
On the first day of my postdoc at Hopkins, I was sitting in an office area waiting to talk with my new boss and mentor when Roger happens to come in on his way to the labs and introduces himself. My first impression was, neat guy, likable, charismatic. This was in 1971. After about a year, Roger moved to Houston, but we stayed in touch and would get together at genetics meetings. Well, long story short, we talked of getting together someplace in the South, which evolved into a vision of developing a genetic center similar to what we had been trained at.
Several key community leaders ultimately led to GGC landing in Greenwood. Boykin Curry, Bob Irwin, Bill Clauber, Fred Williams, and of course, Jim Self.
We would not be here except for the philanthropy of a Greenwood businessman, Mr. Jim Self. Mr. Jim Self was a textile businessman, and we had the opportunity early in our development phase of being introduced to Mr. Self.
Well, my grandfather was always very intellectually curious about things, so I think the science and the potential of genetics would have intrigued him greatly, and I think he saw the potential benefit for Greenwood for the center to be based here.
Individually and with the Self Family Foundation as a lead, he called on business associates, local and state politicians, and other foundations for help in getting Roger up and running in research and treatment of genetic disorders.
With additional funding support from the South Carolina Department of Disabilities and Special Needs, and under the leadership of Dr. Stevenson and Dr. Taylor, the small initial GGC staff of 4 laboratory technologists began work, creating this new organization that would establish itself as a pioneer in the emerging field of genetics.
I was working in the pathology lab at Self Memorial, had been there for about 6 years, when I heard that there was a new pediatrician in town and that he wanted to start a genetics laboratory. So I thought that would be very interesting and went down to his office in the basement of the hospital. I was one of the original 4 to be hired. So we started off with, it was like a small family, Dr. Stevenson, Dr. Taylor, and 4 of us techs. And from there, we started our first laboratory was in Dr. Stevenson's house in his living room, where we cut out chromosomes with big scissors. And so it went from there to the microscopes with cameras mounted on the top so that we could take pictures.
With the development of new genetic testing technologies, GGC's laboratories grew to include chromosome analysis, biochemical testing, and DNA sequencing, enhancing the ability to make an accurate diagnosis and improve patient care. The developments in genetic testing technology over the past 5 decades have been nothing short of remarkable.
It's mind-boggling to me that only 18 years before we started our fellowships, the DNA helix structure was discovered, and the number of human chromosomes was finally determined only 13 years before we started. And now we are able to sequence the entire human genome and make diagnoses for many more patients.
From the very beginning, GGC's goal was always very clear: to provide the highest quality genetic services to those impacted by genetic disorders. Through unparalleled compassion for the challenges faced by families and the latest state-of-the-art technologies, GGC's founders wanted to create a place where families could come for answers, support, and hope. That vision has driven GGC's growth over the years.
That was always exciting, to find a diagnosis for a patient, to help a family. It was just heartwarming.
The Greenwood Genetic Center is so special because of our commitment to patient care. The center's mission and culture drives everything we do every day, and that's why I love working at the center.
So we're super thankful for Greenwood being able to work us in and give us a timely diagnosis, because with most rare diseases, time is of the essence. So being able to have a company that literally took the time and made sure that we had a timely diagnosis saved his life.
GGC's innovative efforts in research also paved the way for breakthroughs in understanding and treating genetic disorders. GGC gained national and international recognition through its research initiatives, particularly in the areas of birth defects prevention and X-linked intellectual disability. Research that not only provided valuable scientific insights, but also directly influenced clinical practice.
And thanks to the great work that the Greenwood Genetic Center provided us and their research in determining that he had a mutation that had never been seen before, they were able to deliver us the news that we had been searching for 7 years, which was a diagnosis. And so we will forever be grateful to the Greenwood Genetic Center for what they gave us that day.
So in terms of the emotional satisfaction of helping, of knowing that we're helping people, and the scientific and intellectual stimulation we get from our job, I feel like we have the best of both worlds here at GGC.
Education has always been a cornerstone of the center's mission. Through student outreach, teacher support, community programming, and provider education, the center works to raise awareness about genetics and build the workforce for the future.
I think I have spent every summer since my freshman year of high school here at the Greenwood Genetic Center, participating in the various educational camps and internships here. I would not have it any other way. Everything I have learned here, experienced, seen, has helped me turn a subject that I found really interesting and fascinating in school into a future vocation I'm currently pursuing.
For 50 years, the Greenwood Genetic Center's commitment to compassionate and quality patient care has been central to our mission and to our success. That continued commitment is exactly what is guiding us into the next 50 years. With a newly defined focus on precision medicine and with collaborations with other leading institutions, the 200 dedicated employees of the Greenwood Genetic Center are continuing to shape the future of genomic medicine and are working to ensure that the benefits of these advancements are accessible to every family in South Carolina.
I love working at GGC because it is both fun and challenging. It is the hardest job I've ever had, but also the most fulfilling job that I've ever had.
GGC is so special because our people have a passion for finding answers and improving the quality of life for our patients and families. Even those of us on the operational side of the GGC take pride in being a part of the difference we make in our patients' lives. We're not afraid to take the road less traveled.
I think he'd be very proud on the impact that the center has had and the number of lives it has touched, both patients and students and families over the first 50 years. And I think looking forward over the next half century, he would be really pleased to see the collaboration with Clemson and Project Hope, and I think he would see the partnership with MUSC along with those as an exponential multiplier to the number of lives that we can impact going forward.
We just are so grateful to the Genetic Center, Dr. Skinner and the staff here. I don't know what we would have done if we would not have had this team on our side.
We are really thankful for the work of the Greenwood Genetic Center, everything that they have done and continue to do for Nora and all of their patients.
I think what makes GGC so special is that we're all so patient focused, that we all care so much about our patients and we have the same mission, and this just brings the best care and outcome. And you can see that in the services that we provide. I have never worked in a center so patient focused before, and I'm really proud to be part of the GGC family.
It may have been serendipity that I met Roger, but I think it was fate, at least on my part. Since 1971, when we met, it has been a wild ride with Roger, even bumpy at times, but it's been an absolutely wonderful ride, something I would not trade for anything. I am thankful for that fateful day in 1971 and for Roger asking me to be a part of the vision that has become the GGC it is today.